Hi, my name is Cindy Rizzoli. I'm a registered nurse with Alberta Health Services, and I'm going to describe the next stop on your surgical journey, the recovery room. When your surgery is completed, you'll be transported to the recovery room on a stretcher by your OR nurse and anesthetist. They'll tell your recovery room nurse a detailed report about the surgery you just had and your medical history. Your family won't yet be able to see you though. Now is a time for quiet and privacy while your recovery team cares for you. But don't worry, you'll see them soon. Your recovery room nurse will ensure that you are kept warm, safe, and comfortable at all times. To keep you warm, you might get a fresh warming blanket or a heating device may be turned on again. To keep you safe, you'll also be connected to monitors. These help your recovery room nurses continuously monitor your heart rate, breathing, oxygen saturation, and blood pressure. Your nurse will also frequently check any drains or tubes you have, such as a catheter and your IV. Additionally, your nurse will keep an eye on your wound dressing. Finally, to keep you comfortable, your nurse will regularly ask about pain and nausea and administer medicines as needed. We like you to use a pain scale to tell us your pain level. So you will be asked to rate your pain on a scale of 0 to 10. 0 means no pain, and 10 is the worst pain you could imagine. Your pain score helps us choose the best method to manage your pain at that particular time. We'll keep using this scale throughout your hospital stay. Some patients having surgery will have an epidural or another method to numb the surgical site and help with pain control. If you have one, this will numb you from the mid-chest down, so the recovery room nurses will check a few extra things, such as your sensation and leg strength. Some patients will also have a PCA pump, also called a patient-controlled analgesia pump. This is another option to help with pain control. If you are going to have an epidural, PCA, or any other method of pain control, your anesthetist and/or surgeon will discuss all of this with you in much greater detail before your surgery. At what point will we move you out of the recovery room? Well, you have to meet certain discharge criteria first. For example, you have to be awake enough to cough and breathe deeply. So we'll ask you to start doing this. After surgery, most people don't want to take a deep breath or cough because it hurts. But these actions are important. Why? Because coughing and deep breathing helps prevent complications such as pneumonia. Once your anesthetist and/or recovery room nurse decides you have met the discharge criteria, a staff member will move you to a room on a surgical unit. A detailed report about your current condition, your surgery, and your health history will be given to your unit nurse. And finally, once your unit nurse has assessed you, your family will be able to see you again. I hope you found this information helpful. From the entire recovery room team, thanks for putting your trust in us. I assure you that we will make your comfort and safety our priority.